In 2018, we have been in a pursuit of answers of common questions that caregivers encounter as their person progresses. And today we're going to be tackling the question, when it comes to supplementary medical care, what is necessary and how can I make it simple? I know oftentimes this becomes a challenge because it's almost an afterthought. You start to run into problems as you're scheduling these appointments. And so we thought this would be a really valuable topic to cover for today's session. It's my pleasure to introduce our expert today, Dr. Daniel Goldfarb. Dr. Goldfarb received her MD in 2011 as a member of the inaugural class of the University of Arizona College of Medicine, Phoenix. Prior to medical school, she was a program assistant for Hospice of the Valley Dementia Program under the mentorship of the esteemed Jan Doherty, at which time Danielle's interest in dementia care blossomed. During medical school, she was involved in clinical research at Banner Alzheimer's Institute and Banner Sun Health Research Institute. For her postgraduate training, she completed the Brown University Combined Neurology and Psychiatry Residency Program, and over the last year, a Neurodegenerative Disease Research Fellowship at the Butler Hospital Memory and Aging Program in Providence, Rhode Island. She's ecstatic to be back in Arizona and join Banner Alzheimer's Institute. Welcome, Dr. Goldfarb.
Thank you. Thanks. It's good to be here.
Yeah, it's good to have you at Banner Alzheimer's and also to join our webinar this morning. So let's just dive right in with kind of the main question that we're bringing forward today, which is what is necessary? Should the person with Alzheimer's disease continue to go to routine medical appointments, such as their dentist or their eye doctor, those sorts of things?
Mm-hmm. I think this is a really important topic, and the thinking on this and the approach has evolved a lot, especially over the last decade. It's very clear that we need to more take into consideration as providers the preferences of the patient and the caregiver, along with other factors such as their age, other medical issues, and what is the functional status and cognitive status of the person that may have these appointments. So this is a very dynamic situation, and so it has to do with, it's very much case by case. And so maybe we can sort of go through each of these topics and talk about, at different stages, what might be appropriate and other things to consider.
That would be fantastic, which I think we should do that with our next question.
Great.
Perfect lead into that, which is, what should we even be considering?
Absolutely. So the most important thing, as always, is to think about what are the benefits and what are the risks. And so putting together all of those other things I just mentioned about the person with dementia and the caregiver, how do we decide? So I like to think about it as we have screenings that are done, such as the primary care doctor will talk about cancer screenings. And then the other big area are these more yearly health maintenance activities like dental care, eye care, hearing. So I'll start with the cancer screenings, let's say. Now, there are guidelines that are put out by the United States Preventative Task Force to guide physicians, primary care doctors on age, what age should, we stop screening people for things like colon cancer with a colonoscopy, breast cancer, prostate cancer, cervical cancer. But those guidelines, though they're evidence-based, they don't have a lot of, the individuals that I work with. So there aren't a lot of dementia individuals that were studied to guide our care in these ways. So what we have to consider is what stage is the person with dementia at? How much can they understand about what is happening, the actual test that's involved, and what the diagnosis could mean, and then what are risks of the test, and then subsequent treatment were we to have a positive test. So let's give an example. So say we have someone with moderate dementia who's 75 years old, who they got a letter in the mail that said, time for your colonoscopy. Let's say they're 7 years old, so time for your colonoscopy. And so these are just automated letters that are going out, and so there's no consideration of, where is the person actually at. So with someone who has moderate dementia, moderate to severe, if we think about it like if a person has less than 10 years to live, then screening such as colon cancer, colonoscopy wouldn't actually pay off in the long run. And in fact, all of these cancer screenings are not recommended in individuals who have less than 10 years to live. But if we shift to thinking about, so let's say they do have at least 10 years to live, it's really important that the caregiver talk with the primary care physician and have a real understanding of what are we going to do if we find a positive result, and what are the treatments, and can the person handle those treatments given, like I mentioned, whatever the other medical issues are and where they're at and what their functional status is. So it's a pretty involved conversation, and hopefully your primary care doctor is willing to engage in that.
Interesting. And so when we look at like the health maintenance side of things, would that differ how we would approach the screening?
Sure. So with things like dental care, we typically go every 6 months for a cleaning. Now, as a person has more memory issues, it may require that, we still want to engage in dental care as long as we can, but so at the moderate stages, when a person may become uncomfortable with what's going on and may forget what's happening, we can use some kind of mild form of sedation before. So the doctor can prescribe a one-time oral medication to help with that process to get them through it. Now, as we get more towards the severe dementia stages, this is when it can become very difficult. And a lot of times we see in nursing homes is that dental care is, not able to be accomplished very well. And so it comes down to, if a person seems to be in pain, well, then we might need to, in fact, actively do something about it. And then otherwise, there are strategies that can be done to be much more gentle. And as with all of our dementia approaches, it's very important for the dentist or whatever the provider is to understand good dementia care and techniques and approaches, and to be gentle and to have the right tone of voice. And things can go a lot more smoothly just with those tactics. And also there are ways such as using, this is more day-to-day, but brushing teeth, using a Q-tip and things like that can be done. And so in terms of vision care or getting your eyes checked, so that's a much less invasive test, and to use what we call the Snellen chart, which is reading the letters from 10 feet away. So that can be done as long as the person can cooperate with the testing, and of course having glasses can hugely improve quality of life. Then there is the hearing. Of course, if we can hear better, we can be more engaged. But the big issue with that is that, of course, the hearing aids are so expensive, and that if your person could lose them, then it's probably best not to go through with that.
So it sounds like with so many things, with being a caregiver, you just really have to think through all of the details, and it almost seems like you're talking about this like tiered approach where we start with what is the actual test and how will the person handle that actual test, and then we move to what would I do with the results of the test, or what would I do with the results of the routine medical appointments if I get new hearing aids or something like that.
Exactly. So I think, can we talk about a cancer screening example? Because sure. I think that is something that has a lot of implications. And, we all hear a lot about go get your breast cancer screenings as a woman, and it can save your life. But these tests, you know, they involve potentially, you know, if a person has a positive mammogram and they then have to get, you know, potentially a biopsy, and then can they handle the subsequent tests every time? So the biopsy, say, is positive, and then they may have to have chemo and a lumpectomy and radiation. And so can your person tolerate and handle those things, and are they going to be better off because of it? And also say something like prostate cancer screenings, which is a controversial topic. So if someone has no symptoms of prostate cancer, and then we check what's called the prostate specific antigen, or the PSA, and say it's elevated or positive, then this person may ultimately go on to have a prostate cancer diagnosis, but that's not going to benefit the quality of life in the long term, because the biopsy and the resection of the prostate could lead to urinary leakage, incontinence, impotence, and things like that, such as the urinary incontinence could contribute to falls, you know. So we have to think every step of the way in that regard.
Mm-hmm. Interesting. And I think those examples are so helpful in kind of considering what we should go forward with and what we maybe should pass on. Another question that comes to mind when I'm thinking of this type of medical care is, are there any other options? I hear whispers of things like telemedicine, or are there opportunities to bring doctors into your home so that if the real issue is just getting the person to the appointment, can we potentially bring it to them?
So there are options for doctors to come into the home. In terms of dental care, I'm not certain about locally what we have with that, but I would say contact your local dental society. And similarly, that is what we could do. I would recommend doing, just in terms of finding local providers in every area that understand dementia care. And
And definitely, I think it's important to engage in your support group, because those are the other caregivers who are so well connected, and they may know of a gem out there that even, you know, other providers or professionals in the area may not even be aware of. So definitely look towards your peers as well.
Absolutely. When I've attended or been a fly on the wall at support groups, it's really incredible, the wealth of information and wisdom that folks have, and so they're really going to be key in this situation.
Mm-hmm. And also helpful in helping you discern when you're weighing the options. You can talk to them about what they decided to do when that automated letter got kicked out to their person.
Right.
So
I think that sometimes there's a feeling of sort of a moral obligation to have these things done. Especially maybe if you're an adult child of a person with dementia. But it's so important that we put ourselves in that person's shoes and think about what the experience is going to be like for them, and are they going to benefit. And I've, you know, from talking to primary care colleagues, it seems like a lot of times they will volunteer the idea that maybe the person with dementia doesn't need to have the screening test, and it seems like the caregiver feels very relieved because there was a sense of guilt about not doing these tests. But in reality, it's really for the benefit of the quality of life of the patient to make that decision. And I'm not saying that we should not ever have the test. It's just we need to factor in all of these things.
I'm so glad you bring that up, because so much of caregiving a lot of times brings up the emotion of guilt and this feeling of obligation that you need to do these certain things and hold your person to the standard that they were once held to. And so I can definitely see giving permission provides a sense of relief.
On the other side, though, you may have a provider or primary care doctor that, you know, wants those screening tests done and maybe isn't on the same page as you. And so, you know, I certainly encourage you to advocate for your person, and you can, you know, you can make the choice of whether or not to do those things. You know, your primary care doctor does not have to have the final say.
Right.
And just to mention, there are some other, so for colon cancer, there's a newer non-invasive option, which is great. It's not, it's a fecal swab test, so you don't even have to go in and have the colonoscopy and the whole thing. So things like that, you know, primary care doctors know about, but that's great.
So we decide that we want to go through with this screening, or we want to go through with this routine appointment. Then the next step becomes, how do we get our person ready for this?
Sure.
Do you have strategies that might help caregivers?
Yeah, so I think that as with everything, for a person, any kind of activities outside of the home for a person with dementia, they can be very exhausting. And so we want to make sure they're at their best. And I would say the morning is the best time for almost everyone in this situation. So you want to try to have a good night's sleep and avoid fatigue. And I would say to make sure that the office staff and the technicians and folks know that your person has dementia and that they are prepared to make this a good experience. And then I wouldn't talk about the visit prior. I think that might just make the person more anxious unnecessarily. And then, as I mentioned, you know, certain tests such as dental exams might, you know, need a little medication before to help calm the person, and that could, you know, that should be planned for.
And I think that's helpful too, because I can recall even being a caregiver at one point and needing to set up these medical appointments, and you call the doctor's office and you almost feel like you have to take the time that's offered to you. But stepping back and considering, no, what would work best for us in this situation?
Yes. And also, you know, I would say educate the staff. They might, you know, appreciate it. Everyone's going to benefit from that at the end of the day if the person, you know, has all the factors are optimal for them.
You mentioned don't mention this ahead of time. I know oftentimes here at Banner Alzheimer's, I'll hear our front desk staff talking to family members because they say, I can't get my person to the appointment. Do you have any strategies to help when it comes down to that moment? We need to get in the car and head to the appointment right now.
Well, I think that this is, you know, again, where caregivers are going to be the experts in what's worked for their person in the past. Of course, you're going to need to prepare plenty of time in advance. And you could say that you're going to somewhere that's going to be pleasurable, such as going out to lunch, and you will go out to lunch after the visit. So this, you know, this concept of therapeutic fibbing is something we talk about a lot. And it's always with the sort of the end goal in mind that you're looking to improve their life, their health, and their quality of life.
Definitely. I think that kind of dangle the carrot, have something pleasurable afterwards, downplay what we're doing right now, oftentimes works really well. Another thing that I've heard recently, we had a caregiver talking about how he maybe wasn't the best messenger of the news. He had a neighbor who worked really well with his wife. And so they actually had the neighbor ride along to the appointment, was able to keep her calm. So think about, too, is there someone who speaks really well to your person or can get them to do anything? You know, is that an adult child? Is that a grandkid?
Sure. Because sometimes the caregiver, that closest person, kind of has to take the brunt of the negative stuff. And so someone else could make things a little lighter. And that's a great idea, Heather. I like it.
So now we've gotten the person ready. I guess maybe actually we should step back before we get the person ready for the appointment. And you've touched on this already. It seems like a lot of doctors are not well versed in Alzheimer's disease. And so should we prep the doctor ahead of time, or the office staff, and how do we do that?
Good question. So of course it depends on what the clinic is, what the setting is. and what kind of information you've gotten ahead of time. But I would say get the information in advance, call the office, and get a really good understanding of what are their resources and how smoothly, can you even get into the building, get to where you need to go. You want to, of course, try to minimize being in places with too much sensory stimulation, and of course, in these healthcare settings, that may be impossible. But I think, to let individuals know, whether secretly or openly, that your person has some memory issues, and so we need to do things a little slower. And I think people do appreciate the education about talking to someone, approaching someone from the front and things like that, and modeling the behavior. So we do the best we can, and there's so many people involved in all of these appointments that, of course, it's impossible to get to all of them. And who knows, you may find some gems that you didn't even have to let them know, and they already knew how to treat your person in the best way possible. So
they just have it, yes. I know sometimes too, again, speaking to the clinic at BAI, I've had caregivers who want to convey information that they maybe can't convey in front of their person, and so they will send an email ahead of time, or they'll send a letter ahead of time, and just kind of slip it to the front desk subtly. Perfect. To let them know.
Right, and we actually have business cards here that we give out that say on the back of it that my person has some memory issues, and so that's a great idea to have something like that at all times, frankly.
But yeah, I think it's so important to share those strategies that oftentimes as a caregiver we've learned on the hard way. But everybody involved in this appointment wants it to be successful. And so we need to arm providers and other staff with those tools. Like you mentioned, don't approach from the front, and slow down your rate of speech, and watch your nonverbals, and all those sorts of things.
Exactly.
So I want to thank you so much, Dr. Goldfarb, for your time this morning and talking about, I think, this really important topic that, again, we don't necessarily consider it until we run into these appointments. Did you have any final comments or thoughts that you wanted to share with our listeners today?
No, just again that, really have the conversations with your healthcare providers and staff, because your person the best, and everyone will benefit from having the most information in this situation. So feel empowered to do that.
Great. Thank you again. Welcome to Jenner Alzheimer's. And we will look forward to learning more from you again in the future.
Excellent. Thanks for having me.
I want to invite our listeners to join us next month. It looks like I have July listed on there, but that's actually supposed to be a September date. For our topic, we're going to be talking all about brain health next month in a subject entitled Love Your Noggin. I would encourage you to use your voice after today's session. You will be emailed an evaluation. Please take a few moments to fill that out. Let us know what you thought of today's session, and if you have any suggestions for future topics. We create these dialogues for you, so please help us shape them in a way that you want to see them. Also, this session has been recorded and will be posted on our website within a few days after the end of today's session. Thank you so much for attending the Dementia Dialogues, where we bring the dementia education to you.